From the nonpartisan Maddy Institute and the California channel at the state capitol, this is a Maddy Policy Brief. Welcome. What are Governor Brown's proposals to address the state's projected $72 billion unfunded liability for state employee retiree health care? Our guest is Nick Schroeder, the retirement benefit expert at the nonpartisan LAO's office. So there appear to be two elements to the governor's proposal. The first concerns how to fund retiree health benefits. What's the governor proposing?
So within that part of the proposal, there's really two pieces. One is what to do with the existing unfunded liability. So that's the benefits that have been earned to date by current employees and retirees. And the second piece is what to do for pre-funding the benefits that are earned in the future. So for the existing liability, the governor proposes continuing this pay-as-you-go process for about the next 30 years until it's paid off. And so that would be, we're going to be paying $2 billion in this next budget year. And at the end of the 30-year period, it would be about a $7 billion payment. For
and let's put that in context. How big is the state budget?
It's about $100 billion.
$100 billion, yeah. So 2 to 7% of the state budget just going for this one issue, just to be clear about it.
Yes.
Yeah, that's a lot of money. And so there's also this pre-funding.
Right, so for pre-funding, what the governor proposes is phasing it in through collective bargaining so that employees and the state each pay half of what's called the normal cost, and that's the amount of money that needs to be set aside each year to pre-fund the benefit that's earned.
So normal cost is that's my benefit right now. I'm going to pay for it going forward. It's not the accrued liability from years past.
Right, it's looking forward. It's the amount that needs to be set aside to pay the benefit that you're earning today.
And they're going to do this through collective bargaining, which means they're going to sit at the table and negotiate.
Right.
And at least my understanding of negotiations is I'm not going to give you something for nothing. And so if the employees already have retiree health benefits and the governor and the state wants them to give it up, what's going to happen there?
Well, if there's an offsetting increase in their compensation of even $1 or 75 cents, the state's costs to share this benefit would actually be more expensive than if the state just paid the normal cost completely.
Okay, so explain that to our folks. So,
sure.
So I say, okay, fine, I'm not going to have retiree health care anymore. It's going to be different, less of an amount. So I want higher wages. I want my salary to go up to make up for that.
Yeah.
So why, it's just a one-for-one deal, right?
Right, so the $1 increase to your pay actually increases the state's cost by, on the average employee, by $1.30.
Why is that?
And that's because we have to pay for your pension and your Medicare and Social Security, and these are all benefits that are salary-driven, which means that as your salary increases, the cost for that benefit also increases.
It's like a ripple effect.
Right.
Okay, so the second part of the governor's proposal is to change what health benefits future employees are going to get in retirement. How would he change that?
So he would reduce the benefit by making employees work 5 years longer. And so to be eligible for the benefit, the future employee would need to work for at least 15 years. And then to receive the maximum benefit, they would need to work for 25 years. Okay,
and the maximum benefit, as you were talking earlier, it was 100% for retired workers.
Right.
Would they keep it at 100% or would they drop it down to 80?
Right, so the governor's proposal would reduce it down to 80, which is more akin to what the typical employee would receive in active service.
Okay, so more years of service and a less of a benefit.
Right.
And this would be, I assume, for new employees.
Right, so it'd be employees first hired after January 2016.
Okay, so what is your assessment of the governor's proposal?
You know, we think that he identifies a very important problem. It's something that we've raised in the past. That being said, we think his proposal also raises a number of questions.
Okay.
And because of that, we think
but
that...
By the way, I'm sorry for interrupting
Sure.
you, but I want the folks to see this report that you did. I just want to plug it and just say, you know,
Sure.
the LAO does these reports on a regular basis, very valuable and informative. So if people want to learn more about it, they can read your report. Sorry for interrupting. So,
no, a plug is fine.
But I saw that and I want to make sure our folks knew about that. So what is your assessment, again, going back to the governor's proposal? You think there's some issues there?
Yes, we think it raises a number of questions that the legislature should consider. And so in the end, what we recommend is that the legislature's policy committees hold a series of hearings to discuss the governor's proposal and also any other proposals that might be out there to address this liability.
So what do you think the key questions the legislature should be considering?
You know, in the report, we raise a number of specific questions. The first question, it's kind of the threshold question, is what should this benefit look like going forward for future employees? And we're in an environment where employees are more likely to retire at a later age, closer to Medicare eligibility. And with the Affordable Care Act, they're also able to buy insurance on the exchange if they're not yet eligible for Medicare. So
very different than the way the system was when it was first set up.
Right, I mean, it's set up originally in 1961, so before Medicare was even a thing. So it's possible that future employees will value this benefit less than it costs the state. And if that's the case, then the state and the future employee might be better off offering some other type of compensation.
So the real question here is, do you need this benefit to recruit, retain, and motivate the existing workers? You're saying you may not.
You may not, or you may need to reduce it, or just change it. And that's really the first question that should be asked, because that really will determine the funding plan going forward.
Okay, well, I want to thank. For a more in-depth analysis of this and other public policy issues important to Californians, please log on to our website at maddyinstitute.org and click on the Policy Analysis tab.